October is Breast Cancer Awareness Month, and before the month is over, we want to bring a couple of experts in to discuss the importance of breast health and being proactive because it can make a difference. Dr. Rachel Pahls, a breast radiologist at Baptist Health, and Dr. Julie Turner with the Baptist Health High-Risk Breast and Hereditary Cancer Clinic join us to talk about screenings and early detection. Ladies, thank you so much for coming in.
Very welcome.
Dr. Turner, let's just start talking about when should someone start screening?
Yeah, you should get a risk assessment done at age 30 to see if you're high risk or average risk. But if you are average risk, mammograms start at age 40 once a year. If you're high risk, mammograms will start at age 30 once a year.
Who would be at risk for breast cancer?
I love this question because every woman in our state is high risk for breast cancer in ways to me, because 1 in 7 is the chance of having breast cancer here. That's average risk is 1 in 7. But yes, to me, every woman is at risk for breast cancer.
Dr. Pahls, what kind of examinations do you offer as a breast radiologist?
Yeah, I kind of wanted to speak on breast radiologists in general. So we are a subsection of general radiologists that do additional years of training, so we can focus on exams that concentrate on breast and cancer diagnosis and treatment. So we predominantly focus on the interpretation of mammograms, which include that 3D tomosynthesis, which is kind of the newer form of mammograms now. We do breast ultrasound, which does include that ABIS exam for dense-breasted women, which is kind of a form of whole breast screening ultrasound. We do breast MRI and PET CT. Most of the time in clinic, if we're not talking with patients, we're either interpreting those exams or we're doing kind of a whole large amount of sorts of non-invasive biopsy procedures, which we can do in the clinic. Most of them are done at bedside with just local anesthetic, so the recovery time is almost nothing. We also assist with a lot of surgical localization techniques. So we use, and the technology is amazing now, but we use either small wires or small little markers that we can put at the exact site of an abnormality to assist those surgeons in the OR to find those small areas.
Say someone finds something that is not normal, what do they do next?
Right, so if you come to our clinic and you got a screening mammogram and we found something abnormal on there, we would get your report read, everything shows up in my chart near immediately. We would have somebody from our clinical team contact you almost immediately as soon as that report is released and let you know, hey, the doctors want a few additional views. Now, about 10% on average of women are going to be called back on a screening mammogram, and that's not uncommon. So especially during like your first mammogram, the baseline mammogram, you're going to get called back, and that's okay. Most of the time when those women come back, it's going to be artifact or dense tissue that's overlapping or completely benign findings like a cyst or benign calcifications. But when you come back to the clinic, we'll do those extra views. You will meet with one of the breast radiologists. They will go over all your imaging with you, and they will discuss their recommendations as far as if we need to do short-term follow-up to watch something closely, or if we need to actually do a biopsy.
That's good to know that most women probably would get a call back, because that can be kind of scary if you get the call and you know, you don't know what's going on. Okay, Dr. Turner, let's talk about signs and symptoms of breast cancer. What do we need to know about this?
Yeah, so for the patients that are in our clinic, I always talk to them about doing a self-breast exam once a month. I always tell them, you know, ideally you would do it after you complete your cycle every month for women, but if you can pick your favorite number every month, it's easy to remember. But you want to do not just a self manual exam. You want to do a visual exam as well. So I always recommend looking in the mirror, hands on your hips, looking for nipple dimpling, looking for changes in skin, looking for flaking of the nipple, things like that. You're obviously looking for any knots or nodules that you find. Any redness, also pain can be worked up. Often pain is other things, but you want to make sure it's not cancer as well. I also tell patients to include the area under their arm, so the axilla region, to make sure you're not feeling any lymph nodes that are increased in size or swollen lymph nodes. It obviously can be other things, but we want to work it up to make sure it's not an early sign of cancer.
We talked about who is at risk, but who is at high risk for breast cancer?
Yeah, this is what I do every day. So follow women in my clinic that are higher risk for breast cancer than the general population. So having a family history of breast cancer can greatly elevate your risk of having breast cancer. So a lot of women have a mom or sister or daughter with breast cancer, and that can make someone high risk. Also, dense breast. So on your mammogram, you'll see a component underneath it saying, you know, your breast density, and so having extremely dense breasts will elevate your lifetime risk of developing breast cancer. Other things like having radiation, previous radiation from other cancers can elevate your risk, things like that. But smoking, obesity, sedentary lifestyle, the things that elevate everyone's lifetime risk for all cancers obviously are in that as well. So.
Perfect. Ladies, thank you both so much for joining me. Of course, you can always reach out to Baptist for more information. Thank you so much for this. Really appreciate it. All right.